Welcome to Movember. It's Men's Health Month.
So stay tuned so we talk about the things that every man needs to know. Hi, welcome to Sage Health TV, a weekly show where we give you tips on optimizing your health and wellness. So please like, follow, and subscribe below so you don't miss an episode. Today we're going to be talking about, it is Movember, and we're going to be talking about men's health today. And we would just want to go over men and women for your men. Like, we want to go over, like, what are the things that you should be looking for, for prevention in your health. What are the risks that men have? And then how can you prevent, these risks, these future possible risks, related to, a man's health.
So this is a really important topic. There's some very sobering statistics, in my opinion, around men's health. On average, men live 5 years, have a 5-year shorter lifespan than women, and the reasons for that are varied. But starting right off the bat, men have or use half as many preventative care visits as women. Right, so they're just off the bat, men are going to the doctor a lot less frequently. 1 in 2 men will get diagnosed with cancer, and the diagnoses often come later than they do for women, which is one of those issues for not going to the doctor more frequently. In terms of mental health, although 1 in 4 adults are diagnosed with a mental health issue, the number of diagnoses is actually lower in men, and yet the number of suicides that occur in men are 4 out of 5 are actually male. So there's a big gap there, just kind of across the board with men getting the health care they need, whether it's not that they're separate, but physical and mental wellness. And so there's some sort of something's happening there where men are not getting themselves to the doctor and not getting the care they need.
And I think it's, women, we are typically, we are considered more of like the nurturing. And so we, just as I know that's really kind of a stereotype, but women, just I think are maybe it's our society. It's hard to know like why women feel more comfortable with exploring those things earlier, and really, the same things apply for the prevention of things that we catch in women. For men, that, and I think men are, just having brothers, having a husband, having lots of male patients that and friends that I think men are probably, it's a little harder, a little more like, I can deal with this. Yeah. You know what? I'm strong. Like, I've got this going on. It's going to be just fine.
Yeah. And then just, so really, the goal is not waiting until things have gone so far and are so drastic till you get in and get some support around those issues, or even just a routine screening to make sure everything is good. So there's so many topics around, in men's health, just as many as there are in women's health, which we focus on often. And but today we're going to start. We're going to narrow it down because there are so many things. So we're going to narrow it down to talk about prostate health, which is a huge topic, and also erectile dysfunction a little, because those are two big ones when it comes to the realm of men's health, and ones that typically affect men a little bit, more typically more midlife, although it can happen earlier. And when we're talking about prostate health, we're talking about most commonly either prostate cancer, which it's not the most common thing, but prostate cancer, or benign prostatic hyperplasia, which is called BPH, or an enlarged prostate. Right. And those are two very different diagnoses, but they can really look very similar in terms of symptom patterns. Right.
Yeah. And I know that, like we were talking about before, and that you have a really, related to just a BPH, you have a really good patient story that we were talking about of effectiveness. When these things come up, one thing we really want to point out that these are treatable, and if it's a BPH and a man is having symptoms around that, as far as like lower flow, difficulty with beginning urination, having even pain around urination, or just kind of like a chronic pain in the lower groin area. There's so many things we can do, to actually help resolve that, and definitely lessen symptoms for sure.
And the earlier the intervention, we can definitely support it later down the line in the disease process, but the earlier the intervention, the less of an intervention is needed and the more rapid the results.
Right,
So,
exactly. The faster things are going to happen.
So I always encourage people to be aware of little shifts, like, suddenly, I have to, get up 3 or 4 times a night to go, and I used to not get up at all. But initially that was 1 time, then 2 times. So kind of being aware of those changes, or just that decreased flow where you never feel like it's sort of incomplete. That's one of the earliest things that I hear from my male patients, is that it started out just with increased frequency, inability to completely void, like you're just not quite done, or a little bit of dribbling at the end, or that nighttime urination, or kind of those early signs. And then testing, we talk a little bit about how we test for that.
So we do physical exam, and sometimes men, depending if we're primary care, sometimes we'll loop in a urologist as well, for assistance and confirmation. But then also there are, sometimes this applies and sometimes it doesn't. There's a little controversy around testing, like a PSA, but it is still a valid test. It's still something that I use, in addition to other markers. And then a lot of it is based on, is symptoms. We're starting with symptoms, of what you're experiencing. And then taking it from there, and there are medications that can be used. And a lot of times I think that's probably in standard medicine, someone's going to be put on a medication first when their doctor is hearing these symptoms from them. But, we can go further than that. There are a lot of things that we're going to talk about that actually, where we can support like the process that's happening now, the symptoms are happening now, but also kind of prevent any worsening and also reduce, So, I don't know if you want to talk about your person first.
Maybe a little bit of, maybe at the end, but talking just a little bit more about testing. So there is, it's not uncommon for a man to go to the doctor and possibly get a PSA. That might be about it in that spectrum of testing, other than the routine blood work, a CBC and chemistry. A PSA may or may not be elevated in prostate enlargement, believe it or not. It's more likely to definitely be elevated in prostate cancer. But in prostate enlargement, it is not a definitive diagnosis, really. It is much more symptomatic, but there are other markers that can really give us a clue as to how to address it. Looking at hormones, looking at people's levels of testosterone, free testosterone, DHT, and then to me, some of the most, vitamin D, which is also really, really critical in prostate health, but then looking at estrogens in men. And so as they blame everything on aging, but as we age, we have shifts in our hormones, and that's what's really the causes, and that's something that can be addressed. So men, as start to get older, and start to make more estrogen. Right, and estrogen is one of those things that actually increases the size of the prostate. I don't have a prostate. But, men have estrogen receptors on the prostate, and actually having elevated levels of estrogens and or xenoestrogens, or estrogen-like substances from the environment, will stimulate the growth of those cells. So checking men's estradiol is really, really important, and it often doesn't get looked at. And looking at their sex hormone binding globulin, which might also be binding their testosterone. Those are things that are really an important part of a panel when looking at male hormone health and prostate health.
Yeah, excellent point. Yeah, and again, when we see things that say if we do have an elevated estrogen, we can treat that actually quite well. And again, that might be a combination of things that are natural, as well as there are sometimes medications that we bring on board, like anastrozole. And so, so we might, we're looking at all those factors, and we're looking at, the testosterone levels as well, and actually, optimizing testosterone, as long as it's not converting into estrogen, it's not converting into that DHT, which is a more kind of it's a stronger, more aggressive form of testosterone that we don't want. That actually optimizing testosterone levels can help. In some cases, we don't want anything that's elevated, but just making sure that they're normal, along with, as Dr. Anastasia was saying, the SHBG, which is a protein that carries around your hormones and affects the way that they interact with your cells. So. So all of those are really an ideal panel for a man, I would say, either that has, is experiencing something or has maybe like a strong family history of prostate cancer in his family, or for some reason, has had, like if that PSA is changing, that's something we want to look at as well.
Just keeping an eye on it. And
And
the percentages of the types of PSA for your total also make a difference. So,
yes, absolutely.
Yeah, so it's great to have a baseline, and I think it's, ideal to have a baseline at around, in the absence of symptoms or family history, even just getting that one-time baseline in the early 40s is really good. If people are symptomatic or family history, even earlier. So and again, all stuff that can be done through your normal insurance. Those aren't anything that are special that they wouldn't be covered. So and then once we have the information, the treatments are so many. Can I share?
Absolutely. Yes,
So one person that comes to mind is somebody that I've worked with recently, and his history, in his late 40s, he had a couple bouts of possibly prostatitis, which is more of an inflammation of the prostate. With or without an infection, and he'd been put on medications for those, and it had resolved. And then he started to develop pretty severe symptoms at around 50, and family history of prostate cancer. So that's of a very aggressive prostate cancer in the family. So in his, I don't know how suddenly the symptoms came on, but they hit a point where it was dramatic, and an ER visit and inability to void and that type of stuff. So first thing, just to get him able to urinate, he was put on an alpha blocker called Flomax or Tamsulosin, which is pretty common for men. It doesn't fix the problem. It just helps to kind of decrease the symptoms. And in the meantime, you want to get people comfortable, but then start really preventing the progression of it. So checked his levels. His testosterone was not low. It was actually high, but his estrogen was also really, really high. So he had an estradiol of 57, and ultra-sensitive estradiol of 57, which is the one we like to look at. Really, the top level for a man should be in the low 20s. Right? And so...
top of the normal is 30.
Yeah, and keeping in mind, once again, I always say this, but normal range on labs is not optimal range. Right? So... high estrogen, very symptomatic, and we started him on a program pretty intensive. He was eating, and he was all for it because he wanted to get better. So we started him on something that helps to lower estrogens through helping the liver to conjugate and get it out, and that was something called DIM and calcium D-glucarate. He started eating loads of cruciferous vegetables like broccoli, cauliflower, Brussels sprouts, all these things that actually also have indole 3-carbinol in them, are a constituent that helps to lower estrogen. So all those veggies are great for keeping your hormones in balance for men and women. Started doing a ton of that, and just a few other lifestyle changes, some overall anti-inflammatories, and he was able, over the course of about... we retested at 4 months. His estrogen had come down to 20.
Fantastic.
His testosterone had dropped a lot too, though, and he was starting to feel some of the benefits of the lower testosterone, so we kind of had to find some ways to modulate. There could be too much of a good thing. But his symptoms were great, and over the last few weeks, he's been able to taper off the Flomax and have no symptoms. And in this case, his prostate was not enlarged on manual exam by another urologist, and so he said, "Oh, you're fine. Your prostate's fine." But the case is, you can't always tell on a manual exam. But he was having
all the symptoms.
And so he has, and he also had some kind of concerning numbers with his PSA that we're watching, because we want to make sure enlarged prostate does not necessarily turn into prostate cancer.
That's right.
Most men with an enlarged prostate will, are not necessarily going to get prostate cancer,
Right.
but we want to keep our eye on somebody who has
Yeah.
that history.
And,
So-
and not that this is our subject, but, prostate cancer, most forms of prostate cancer are slow growing. That does not mean that, shouldn't be aware of what you have, or, find out, basically working with it. Again, a urologist would be the one who would diagnose that for you. But there is some kind of maybe peace of mind to know that, these days, again, this is kind of a different subject, but there are so many other support systems that can help, if you've been diagnosed, that can help with healing and help you, in a very I'd say you wouldn't do traditional treatments, but in support of healing of that area of the body. So.
And one other thing we didn't mention in terms of lifestyle things is that another thing along that line of just inflammation and also elevated estrogen is that excessive body fat, especially belly fat, those adipose cells actually produce estrogen.
Yeah. Yeah.
So
very active. It's an active
yeah.
type of fat. It's called a brown fat in the belly, and it produces hormones. It is metabolically active. So very different than fat that somebody might carry more in their legs or their arms.
So actually, even losing weight can help too. If in people who are overweight or have an excessive, ratio of body fat, that can actually help symptoms as well tremendously.
Right.
So
Yeah. And then exercise. I mean, we can see studies of balancing hormones with exercise as well. And then we get into, Dr. Anastasia mentioned, if there's elevated estrogen, we're using DEM, I3C, calcium D-glucarate, occasionally, depending on the man, anastrozole, which is a prescription. And then also getting into, sometimes we do some of the other supplements as well, like vitamin D optimization, also can help the prostate.
and the herbs that are amazing. Saw palmetto is a great one, particularly good when it's once again used in conjunction synergistically with some other herbs like nettle root is love nettle root.
Pygeum.
Pygeum is great, and that combination has been shown. There's been some good studies. Most of the studies I think were specifically on saw palmetto, but in mild to moderate enlargement have been shown to be highly, highly effective. So once again, we want to catch it before it gets past that line.
Yes, absolutely. So thanks so much for joining us today, and remember to love your prostate, not just today, but every month. So please follow, and subscribe below so you don't miss an episode. We look forward to seeing you next time, where we discuss more on men's health.
Thanks so much.